Good morning, Dr. Rodriguez. My name is Alexandra Barker, and today I'm presenting on the skeletal system. I have Ahmed here with me today, helping with my presentation. He's a little bit humorous, and he's excited to be part of our osteo class today. The skeletal system is composed of 206 bones, ligaments, cartilage, and also connective tissue. There are 6 different shapes of bones within the skeletal system. There are sutural bones, pneumatized bones, irregular bones, flat bones, long bones, and short bones. The skeletal system can be divided into 2 classes. We have the axial system, which is composed of the head, the thoracic cage, and the vertebra. And then we have the appendicular skeleton, which is made up of the limbs, the shoulders, the pelvis, and the legs. I'm going to first start on the axial system, and I'll first start with Ahmed's head. His skull here has 8 different bones. We have the frontal bone here. Inside his eye sockets, you would be able to see his ethmoid bone. On the side here, let's see if I can get him closer. On the side here, we have the sphenoid bone. We also have the temporal bone. We have the parietal bone up here, and on the back we have the occipital bone. Now for his face has 14 bones. We have the mandible right here. We have 2 maxillae, 2 zygomatic bones for his cheeks, 2 nasal bones. On the inside of his eye sockets, we have 2 lacrimal bones. Inside of his nose, we have the inferior concha, nasal concha. Also along the perpendicular portion of his nose, we have the vomer bone. Inside of his mouth, making up the upper portion, would be, if you could see and look in there, that would be the palatine bones. Something on Ahmed's skeletal area that he doesn't have would be a floating hyoid bone right here, anterior to his trachea. He would also have 6 auditory ossicles, 3 in each ear. And this makes up the upper portion of his axial skeleton. Now we'll be moving on to his spine. His spine here is made up of 7 cervical vertebrae. The top one, his C1, is called the atlas, and his C2, the one just underneath, is called his axis. Going down here, we have 12 thoracic vertebrae, T1 through T12. Just down here, we have the lumbar vertebra, L1 through L5. We also have down here the sacrum, and this very small portion right down here, this is called the coccyx. As you can see, the spine kind of has these natural curves in them. The 2 concave curves are called the cervical and lumbar curves, and these 2 convex curves here, this is called the thoracic and the sacral curve. Moving on to his thoracic cage, this middle bone, flat bone here, is called the sternum. Sorry about that. And his sternum is made up of a few portions. We have the mandibrium up here, and then we have the body in the middle, and this bottom port is called the xiphoid process. Ahmed also has 12 ribs. There are 7 true ribs, which connect directly to the sternum, and then he has 3 false ribs right here, which don't directly connect to the sternum, and then on the back here we have 2 floating ribs, which don't connect to the sternum at all. And so that makes up the axial skeleton. Now we'll move on to the appendicular skeleton. we have the clavicle bone here making up the shoulder portion, and on the back here, on this big flat bone, we have the scapula. Making up his upper limb, right here we have the humerus bone. This lateral bone here is called the radius, and this medial bone is called the ulna. Now, Ahmed has 8 bones in his wrist, and his wrist you can think of as in 2 layers. We have a more proximal layer, which has the scaphoid, the lunate, the triquetrum, and the pisiform bone. And this lower layer, this more distal layer, we have the trapezium, the trapezoid, the cubitate, and the hamate bone. Now, moving on to his hand here, he has 5 metacarpals, labeled 1 through 5, starting with the thumb. And then he also has the proximal, middle, and distal phalanges of the hand. Moving on to his lower body, this large bone here is his femur. And then moving on to his shin, we have the tibia and the fibula. And then we have his ankle bones. So he has 7 ankle bones. This big heel bone is called the calcaneus. On top of that, we have the talus. We also have the navicular and the buboid. And then these bones right here, we have the medial, intermedial, and lateral cuneiform bones. His foot also has 5 metatarsals with a T, also labeled 1 through 5, starting with his big toe coming out laterally. And then also he has the proximal, middle, and distal phalanges of the foot. And last but not least, we have the pelvic girdle. This is composed of 2 hip bones. And then each of these hip bones are made up of 3 fused bones. And so let's see if we can get to see that. The top portion of the hip bone, this is called the ilium. Down here, this is called the ischium portion of the hip bone. And in the front here, we have this pubis portion of the hip bone. All right, and so that is an overview of many of the bones on Ahmed. In terms of the skeletal system, for me going into medicine in my future, I plan on going into more of a hands-on specialty, which would include potentially being interested in orthopedics. And orthopedics is the specialty of bones and the skeletal system. So if I were to go in and become an orthopedic PA, then I would be working with patients who've had trauma or broken bones on a daily basis. And so it would be my job then to work with them to make sure that their skeletal system's healed properly. And having a strong understanding of all the bones and where they are is very important in going forward in this. So all in all, that's this presentation of the skeletal system today. For me, it's lunchtime, so I'm going to go get some food, but I don't think Ahmed here has the stomach for it. Anyways, thank you for your time, and I will see you next week, Dr. Rodriguez. Thank you.